describe? As usual, site of the mass. How to describe the site of the mass? According to the clock. Yes, you have to imagine patient in lithotomy position. So I feel the mass here. So which clock? Here is the mass. I feel the mass. Which clock?
9.
Sure. 3. Yeah.
12.
It is 3. This one is 3. Right side is 3. Left side is 9. Anterior is 12. Posterior is 6. Yeah, because patient in lithotomy position. Patient will be, I will fall down. Okay, patient is like this. This is the anatomical position. Okay, even now patient in lateral, but we have to imagine this patient in lithotomy position. So this is 12, 6, 3, and 9 o'clock. Okay, so I can feel mass in 3 o'clock. This is not enough. I still cannot imagine exactly where is the mass. I have to describe the distance from the anal verge. So you can feel mass in 3 o'clock, about 7 cm from the anal verge. Okay? It is hard in consistency, intraluminal, and fixed. So it's not mobile. I feel the mass is fixed. Okay. This is male patient. Okay, now I have to move my finger anteriorly. Okay, until I can feel the prostate. Normal size. I have to comment about the size of the prostate, or is it enlarged? Okay, urologist, they will give you the exact size of the prostate. But for us, we have to know, is it normal or enlarged? Enlarged prostate. Okay, both loop. Enlarged. Consistency of the prostate, rubbery inconsistency. Okay, can see hard, can see firm. Right, so hard, firm, and soft. But the normal prostate is rubbery inconsistency. Okay, the surface is smooth. Surface of the prostate smooth, or we can see there is nodules. It's a nodular surface. Okay, and the median sulcus is palpable. Okay. This is exactly what I find just now. Okay, you can confirm what you want. Okay, yes, this is the prostate. Okay, but now we are talking about 2 scenarios. One for the PR bleeding, that's why you're looking for the mass, and the other is for the prostate. Okay, so when you put your finger, actually you are feeling this one. Okay, you are feeling this one. So this is the enlargement. Actually, I measure by my finger can reach to the upper limit. Yes, this is normal. If I cannot reach the upper limit, this is enlarged. Okay, so I can feel the upper the prostate. Number 2, I can feel the surface and the consistency, smooth, and I can feel the median sulcus is palpable. Okay, this is the prostata. If you find that this one is enlarged, you see the prostate can feel very big size. I can reach to the top, big size, both loop enlarged, and smooth surface, and consistency is rubbery, and median sulcus still palpable. So this is most probably is benign enlargement of the prostate. Okay. Sometimes I can feel only one loop enlarged. The other one is normal. Okay. The other normal one is enlarged. Okay. Same. Describe the finding accordingly. But sometimes we can find one loop is hard. Okay. Different. It's hard. Okay. Hard and consistency, and irregular, and nodular. Okay. So median sulcus is not likely to be palpable in this one. It's not likely. So this one we suspect malignancy. You have to admit patient, or we plan for this patient to do further investigation, including transrectal ultrasound and biopsy. We call it TRUS biopsy. Okay. Sometimes the whole prostate is obliterated, and you can feel that there is no median sulcus. I cannot feel the median sulcus, and the wall is hard in consistency and irregular. Okay, so this one also suspicious of malignancy, of advanced malignancy of the prostate. Okay, so this is what you have to comment about the prostatic enlargement. And okay, before I remove my finger, if we have neurological disease, suspected neurological disease, or sometime in pediatric we suspect patient has chronic constipation due to the Hirsch spring or congenital medial colon, we have to comment about the anal sphincter. Okay, now that is easy to ask the patient to constrict the anal sphincter to see the tense, is it tense or lax anal sphincter, and after you remove your finger, we have to comment about the fecal material. Is there any black stool, melena, patient has fresh blood, patient has normal stool, or patient has sometimes pale color stool, indicating some obstructive jaundice, right? Indeed, pale color stool. Okay, this is the give tissue for the patient, and we inform the patient that we finished the examination, and then we have to document the finding in your file. Okay, and This is in case of the prostatic problem. In case of the PR bleeding or palpable mass, then have to continue the next step with the proctoscope. Inform the patient. Now I want to insert my instrument. This is the endoscope to visualize the anus from inside. Okay. Then from the same position, with the direction to the umbilicus, we have to direct into the umbilicus. We have different type of endoscope. This is the solid one. So sometimes we have the transparent one with the light. We have light. It's very nice. So this is not used anymore in the clinical practice. Consider old one. Okay. So to the direction of the umbilicus. Okay. I rotate to go inside. Okay. You should have your assistant. Your assistant will have the torch light. Okay. Then I remove the introducer and ask your assistant to put the light. You can see inside if there is any mass or any dilated vein for the hemorrhoids. Okay, if there is any hemorrhoids, then we have to describe the site of the hemorrhoid according to the clock. What's the common site for hemorrhoid? 3, 7, and 11. 3, 7, and 11. Okay, you can see dilated vein in 3, 7, and so the questions 3, 7, and 11. Okay, confirm, and then put your introducer before you go out. You cannot go out. You have to put your introducer again, and then slowly you go out. Okay, this is the proctoscope examination. It's a very important step for the examination, but usually the exam we give for digital rectal examination. Okay, usually this one is additional, but you have to suggest. Okay. Sometime in the exam, we ask you suggest further or the next step. Next step, I want to do proctoscope examination. Okay. So any question? Proctoscope, abdomen, proctoscope. What else? Other procedure?
Catheter, breast. Catheter got 2, male and female.
Okay. Females is not included. We are not.
Female.
We are not included.